Doctor, you have spoken to many gynecologists. What is their primary concern? What is what do they feel that something that they are not really aware of? This test is not very popular, and when they are asked to do something that they have not done before, what is their major concern?
Most of the gynecologists are doing pap smear, so they are not unaware of the screening program. The most common pap smear technique that is used in India is conventional, and that is used by most of the gynecologists. So we are not telling them something new. They already know the screening technique. Liquid base is also accepted by many doctors. Now, this is a step ahead. Once they are aware that, and they are now slowly coming to know the limitations of HPV testing, because HPV tells you whether it is positive or negative, but it doesn't tell you whether this patient who is HPV positive is going to suffer from cancer or not. This test, DNA ICM, is going to tell you abnormal cells are there and this patient is going to have cancer or is already having a cancer. So once they will come to know about this technique more, I don't think they will stop from using this. But the first step is to let them know, build their confidence and trust in us and in the technique, basically, not us, but in technique and in my DNA lab, and then they will surely do this, because all gynecologists do want to reduce the cancer risk. They do want to help patients to for early detection of cancer. So they are also in a dilemma whenever they see a erosion of cervix, that whether this is simple or this is infective or this is going to go into cancer. So in that case, they always try the help of the pap smear. But since pap smear is a subjective test and DNA ICM is a quantitative test where the cells are measured, they are measured. So we are going to measure the cells seen and the abnormal number of cells. So this is a step ahead, and I'm sure they'll be happy to do this.
So we have selectively worked with some hand-picked gynecologists in this phase, including world-renowned Dr. Vidya Sathe. She has a very respectable, very highly regarded practice in the town of Dound. So can you throw a little bit of light on your working experience with DNA Ploidy test and Dr. Sathe?
Dr. Sathe, who is a renowned gynecologist practicing in Down, we introduced her to DNA ICM and told her to build the trust by using our kits and do it on her patients till she is satisfied. So once she started doing it and getting our reports, which includes LBC PAP report and DNA ICM report, she was very happy. And she is now ready to do it on all patients because she has seen the quality of the test, the test's accuracy, and therefore she is now accepted to do this on her patients. I was very happy with Dr. Umarji, who is another gynecologist in Pune, who is also having a renowned practice. She sent one patient and we found that in that case there were 3 or more abnormal cells, and we advised her that that patient should undergo a colposcopic biopsy, and that patient did have a biopsy and we found the most early changes of cancer in that patient. So wow. Look at this as her life is saved before it went into proper cancer, which people will argue with us that it's not called cancer, it's all precancerous. But we want to detect it at that level. We know that these patients, after going into high stage of RTPR, do not resolve. They only invade. So before that also this is detected, and proper technique, proper follow-up of the patient, or they can do the biopsy depending on the patient's lesion. So Dr. Umarji was also very happy. All the doctors that we have gone and met and taken the test samples from, 10 or 20 cases, they're very happy and they want us to go and meet them and start this at their clinic.
No, absolutely. So last when we met Dr. Vidya Sathe, and she told us that she's switching her entire PAP practice to DNA Ploidy test. So just for clarification, DNA ICM is DNA image cytometry. That's the technique with which this DNA Ploidy test is done. So we have named the test because we have to give a name to a test. We are calling it DNA Ploidy test. However, the technique used to perform DNA ploidy test is called DNA ICM. So that's just for clarification.